Group. We keep our word.
Now, we say that the eyes are indeed the windows to the soul. Vision is important and it's linked to so many aspects of our lives. It's a marker of our independence, our ability to learn and get an education, and just to enjoy the beautiful sceneries in life. Now, today we're talking about a condition that affects millions and one of the leading causes of preventable blindness, not only in Kenya, but worldwide. And on studio today, we have a special guest who's an consultant ophthalmologist. Now, this doctor is a specialist in matters to do with the eye. He is a specialist in cataracts, Dr. Abhijit Rassal.
Thank you so much.
I have been practicing that name the whole evening.
Thank you, that's fine.
Welcome to the show, Dr. Rassal. How are you doing?
I'm fine. How are you?
I'm fine, thank you. Now, I'm your host today, Dr. Lauren Mengesa, yani daktari wa kina mama, and today tunaangazia mambo ya mtoto wa jicho. And before we get into this, we are going to be looking at our case studies. We've been interacting with patients who have not only experienced the symptoms of cataracts, but have also gone through the procedures for surgery. And we want to listen to their stories right after this.
Nilikuwa nasikia tu kama iko mchanga ndani. Sangine nilikuwa najikuna na nasikia kama iko mchanga. Macho pia maji pia inatoka. Na uchungu pia nilikuwa nasikia.
Na hii jicho yangu ya kulia hii kuanzia 2023 ndio ilianza kuja inafunga kidogo na yenyewe kaanza kuleta giza ndani ya macho. Saa nyingine nikifunga hii sikuoni. Sikuoni hata kufanya namna gani. Inakuwa dark. Na nikitembea njiani watu walikuwa wanasema leo huyu Luka anatembea namna gani? Manake naona na jicho hii nisipoangalia vizuri nianguka chini.
Wengine wanasema mingi hiyo pressure ndio inaletea hiyo gonjwa ya macho hiyo yako. Mzuri kama unaenda hospitali, madaktari aende upime wewe.
Ndio nikaona hapana, mpaka niende kwa daktari ili waexamine waone ni nini inatendeka hapo ndani. Ndio ikaonekana iko hiyo mnaita cataract.
2018 nilienda Sabatia. Walikuwa wanataka kunitoa. Lakini mimi ndio nilikuwa na uoga. 2019 pia nikarudi tena Sabatia. Wakaniambia the same thing. Hata hapa Russia nilienda last year but one nikaambia the same thing. Sasa vile niliona kama inazidi, sasa nikaamua wacha nieje tu wanitoe kama hiyo ndio shida.
Now, our proud sponsors on this day are CIC Insurance, who have a vision for your health and make sure that they help you protect who and what you love. Now, CIC have a plan for the whole family, and this actually includes cover for your eye care and ocular plan, and that is the CIC Family Insurance. They also have a plan for seniors, so those above 60 will be catered to for their cataract surgeries and all matters eye health. Now, if you belong to a chama or a women's group, then there is a cover just specialized for you, where you can make sure that you plan for your family and your finances. Now, please talk to us on our SMS lines on phone number below. Our SMS lines are open at 22422. Our socials are also willing to engage you, and that is at Uliza Daktari and at Daktari_Mengesa. Now, today we also have another story from Mary, just highlighting the impact of cataracts and the different things that it makes our patients go through.
I want to take you through my eye journey, which started around 10 years ago, when I realized that I'm not able to read well, and I was seeing like a double vision. So I went to the hospital, and I was told that I need to use glasses, spectacles, which I have been using for the last 10 years. And every year, Also often I go for checkups, and they keep on telling me that my eye is deteriorating. So we keep on changing the strength of the spectacles year after year. And still, as the years progressed, I still notice that even with the glasses, I'm struggling. I need to put my glasses on, and then I put maybe a torch to touch it on what I am reading. From January, I noticed that as I walk, the environment looks like it's a little bit hazy. But somehow, since I could see, I just decided, okay, I'm going to have my specs changed again. I remember that the person who was now taking my measurement advised me that you are having cataract and they are growing at such a high speed. So I need to send you to an ophthalmologist. So when I went there and they took me through, they did their examinations all over again. The cataract were on both eyes and they did the surgery very well. I had a huge covering of that eye. So I was to come the following day so that they remove it and they re-evaluate the eye again. To my surprise, when I was told to read the numbers, it was like I'm singing them. To me, even after the surgery, I was still feeling that I'll still be using the specs. But I was surprised when he said, you don't need specs again. And sure enough, I went home and I looked for my Bible. And I looked at it and I read without spectacles. It was so exciting. It's like I've been born again.
Now, we all share in the joy of Mary, who now has 20/20 vision after her surgery, correcting her cataracts. Now, Dr. Abhijit Rassal is based at the Lions Eye Hospital, which is synonymous with eye care. Now, Dr. Rassal, we want to just find out, before we even get into this discussion, what is the normal eye and what are cataracts?
Okay, that's a good question. So if you understand the normal eye is just like our lens. As we have lenses in every camera, the normal eye also has a lens. It has a cornea. I think we can have a slide. So we have different parts. The front part is the cornea, where from the light comes, it passes through the cornea, then it passes through the lens, and then it falls on the retina. In the retina, when the image is formed, that image is transferred through the nerve into the brain. Our brain is one who is analyzing the images. See, the person standing in front of us is my son or daughter. Our eye doesn't know. It just captures the images. It sends to the brain. Brain is the analyzer. So it is the brain which analyzes. So like you can see, this is the lens. It is what it looks in our image. This is the lens which has a pupil, which is called as the aperture of the lens. So the front part, so this is our lens. So the front part is, this part is the cornea. So the light passes through the cornea, through the lens, and then into the retina. And this part is a nerve. So when the image is formed over here, it is passed from the nerve to the brain. So it is the brain which analyzes, and the eye is just like taking the pictures and sending to the brain to analyzing. So with age, this lens which we have, if that lens, like a lens in our camera, if it becomes blurry, you'll not be able to have a good pictures. So similarly with age, if this lens starts becoming blurry, this is what we call it as a cataract.
Naam. So kuna jicho, na kwa hilo jicho kuna tuseme kama dirisha ama mtoto wa jicho ambapo inaruhusu mwangaza kuingia, na kukikuwa na shida yote kwa hilo hiyo sehemu au hiyo mtoto wa jicho, inamaanisha uoni unaanza kuwa na upungufu fulani. Yani the vision starts to decline. And typically it's a slow kind of process. So that is what cataracts are.
Yes.
Naam. Daktari, would you be able to tell us the types of cataracts? Like hizi cataracts kuna aina tofauti za cataracts?
Okay. The types of cataract depends upon, if you see, it will depend upon what type of presentation is that. So it can present from early age and elderly age. In early age, if it is developed before 6 months, it is called as congenital cataract. After 6 months, it is developmental cataract. If patient is having a trauma to the lens, he will have a cataract. It is post-traumatic cataract. Cataract associated with some other conditions of the eye like glaucoma, uveitis, we call it as the secondary cataracts or complicated cataract. Then we have most common is a senile onset cataract, which is an age-related cataract. So that is very common in all over world.
Now, a lot of the time doctors will ask you, do you have a family history of cataracts? Yani kwa familia kuna mtu yote ambaye ana ugonjwa wa mtoto wa jicho. Is there a relationship? Is there some kind of family inheritance when it comes to cataracts?
Genetics do play a role, especially in terms of congenital cataract. In senile cataract, post-traumatic, and some cases of complicated cataract do genetic play a role.
Okay. Now, kuna magonjwa mengine ambayo tunazungumzia kama tumeongelea kuhusu ugonjwa wa sukari, ugonjwa wa shinikizo la damu, things like high blood pressure and diabetes. Yeah. What is their role in development of cataract?
Okay, now let us come to the etiology. What are the conditions which can be? So like if the patient is having high blood pressure or high sugar, these are associative factors. A patient is having high sugars, high blood pressure, prolonged exposure to ultraviolet rays, they will have more chances of development of cataract. Similarly, a child during intrauterine stage, if the mother has infection during the pregnancy, then she can have congenital cataract. In case the rubella is a very common infection, so rubiosis iridis, and rubella is a very common cause of cataract in congenital cataracts.
What is the youngest patient you've operated on with cataract?
At Lions in Kenya, we have operated 4 weeks.
4 weeks.
We operate 4 weeks.
A 4-week-old baby.
baby.
Oh my God.
And we have also operated till, me personally, I've operated at the age of 108. 108. So that is the span of cataract in our country.
And this is at the Lions Hospital?
Yes.
So hapa Kenya, we are able to do these surgeries locally. We don't need to leave the country to do surgeries for cataracts.
Of course not.
Okay. Now, when it comes to the older generation, at what age? Is there like a particular age group or age range where you typically start to see these symptoms for the senile cataracts? Yani wale ambao wanapata ugonjwa kwa umri ambao uko juu.
Okay. There is no particular age group, but what is that? It's an aging process. So the first aging process of the lens is that you have problems in seeing near. So when you have a good vision, 20/20 vision, throughout your adolescence and then young age, then suddenly the first complaint people will come with, you are not able to see near. This is where your lens starts degrading because your autofocus ability. A camera which is having manual focus and a camera which is having autofocus is a great difference. So when you lose that autofocus ability is what we call it as a presbyopia. The patients are not able to see near, so we start giving reading glasses, which is usually after 40 years. So cataract starts developing any stage from there onwards, maybe 45, 50. As I said, even at some patients do come after 100 years of age.
Okay. Now there's something interesting I read here, and this patient says, I have been, no, not this one. I'm not sure why, but 1 year after going ketogenic in my diet, my prescription glasses no longer worked. When I went to my eye doctor for an exam, she said that her vision had improved and it was better than 20/20. So she asked the patient whether she had been on any low-carb diet. So I'm curious, Dr. Is there any relationship between changes in your diet? Like now she went on a low-carb diet and, I'm assuming completely cut off all the carbohydrates. Can this cause significant improvement in your vision, and what's the relationship?
See, as I said, all are associative factors. One is causative factors. You have this typhoid infection, you will get typhoid fever. So associative factors is that the lens is a transparent structure. The lens fibers are transparent. If they absorb more fluid into the lens, like in diabetes, if the extracellular fluid starts accumulating more and more, then it starts getting blurry. If the diabetes is well controlled, the extracellular fluids are gone. So there can be, at some cases, there can definitely be improvement in cataract. It is just the clarity of the lens which matters, and if it is more clear, it will.
Okay. Now, if you're just joining us, today we're talking about cataract. And Dr. is here to make sure that we understand we have clear vision on this discussion. Now, after the break, we are going to have some exciting videos on the kind of surgeries that Dr. does and much more information on how you can even prevent this cataract. So see you after the break. Now, thank you for staying tuned. Please talk to us on our SMS lines down below, 22422. Our call lines are also below, so please call us and tell us what your experience with cataract is and what are you curious about. Our socials are open at Daktari_Mengesa and at Uliza Daktari. Now, Daktari, people are wondering, how will you know that you have cataracts? How is this diagnosis made? What symptoms will the patient have? And when they come to you, how will you confirm this diagnosis?
Okay, the most common symptom of having a cataract is patient usually have a good vision before. And then there is a slowly degradation of vision. So slow degradation of vision is the most common symptom. And the diagnosis is mainly, it's very simple diagnosis, a slit lamp examination where we examine the patient. A routine examination will help us to diagnose whether you have a cataract, what type of cataract, how much grade it is. We can do it by a simple slit lamp examination of the cataract.
Okay, so diagnosis is simple. Just coming to you and the lamp and you're able to tell.
Yes.
Okay, now how do we treat these cataracts? What are the kind of options we have in terms of treatment for cataracts?
So the treatment of cataract basically relies on doing a surgery. So surgeries are basically two types. One is a small incision cataract surgery where you give a small incision over the cornea or over the eye and then you deliver the nucleus. And the second is the laser surgery, or we call it the phacoemulsification surgery. So we can have just a look at the surgery. If you have a video.
So let's look at the video.
So here you can see that I have putting a dye. I have made a small 2.2 incision and I have made a injected a dye. Then we have put a visco. So this is dye is to stain the cornea. So as you can see, this dye stains the capsule of the lens. After that, now the lens is placed in a capsule. So this is a small forceps we are going. We are removing the anterior capsule in a circulinear manner. So this is the anterior capsule we are removing with the help of forceps, and this is for stabilizing your eye. This patient is under topical anesthesia. So we have not given any general anesthesia or local anesthesia. You can see the eyeball is moving. So after doing this, we are to separate the cataract from the capsule because the bag we wanted to put a lens inside. So now once we have separated the cataract from the capsule, we use a ultrasound probe, which is phacoemulsification probe. It is going through this 2.2 incision. So you can see this. This is the ultrasound probe. So now in the pre-cortex, we are removing the initial cortical matter, which is emulsifying. So now we have to make basically this cataract into 4 different quadrants, and then you emulsify, phacoemulsification. Phaco means lens, emulsify means you make it smaller pieces and then you eat it. So this, you have made the cataract into 2 parts, you can see. Now it has made into 2 parts. I'm rotating the cataract and again now I'm making into 4 halves. So now once we have done it with the 4 quadrants, you can see once it is done with the 4 quadrants with the help of ultrasound, we are emulsifying each quadrant sequentially. So now you see I'm trying to engulf those quadrants. So when you're trying to engulf those quadrants, you're using an ultrasound energy. It emulsifies the nucleus and it makes the capsule empty.
So we are now clearing what essentially is the cataract. To remove.
So when you're doing a small incision cataract surgery, you see the diameter of the cornea is 12. In small incision, you're making it, incision is 6 mm. In this, we are doing incision of 2.1 mm.
Wow.
So that is the advantage of that. So the incision is so small in this and the whole cataract has already come out of the bag. So what now remains is the peripheral cortex. So in this peripheral cortex, we use the...
Okay, so we're going to take a quick call from Kisumu before we come back to this exciting video. Hello.
Hello.
Hello, karibu Uliza Daktari. Catherine, how are you?
I am fine.
Habari ya Kisumu?
Niko salama Kisumu kabisa.
Aya, swali lako tafadhali.
Swali yangu nilikuwa nauliza shida ya macho. Hizi macho zimeanza kunisumbua, zimeenda karibu miaka kama 3 hivi. Sasa niliendanga hospitali, wakinipima, wakinipatia zile macho za kuonea.
Miwani.
But sasa nilikuwa natembea, ukitembea unaona ni kama unaenda kuanguka kwa shimo. Jicho moja inaona na hii nyingine haioni, but inafika mahali sasa macho zinatoka moshi, machozi, sioni light. Zinaniwasha na kuna ndani kabisa. Sasa sijui, I don't know problem ni nini.
Una miaka ngapi tafadhali?
40 bo.
40.
Niko na 40.
Okay, asante. So Catherine is 40. She's been having a problem with her eyes. She's been given spectacles, still not improving. They're teary, they're irritated. When she walks, she feels like she's not seeing clearly, and she's wondering what the problem might be.
So her distance vision seems to be very good. And is she having a distance vision problem also, a near vision problem also? So usually, as I said, if the patient is having a good vision before, and now she is having a problem in near vision, so first we ask whether she has a problem in reading or not. If she has a problem in reading, then you have to diagnose it as a presbyopia, and because the distance vision is clear and near vision is not able to see. So when these patients we shift to glasses, usually they have bifocal glasses. The bifocal glasses means there are two different foci, one for distance and one for near. So whenever they are shifting those foci into the glasses, they are having problems in stepping down and walking, especially from downside. So I feel she just need time to get adjusted to these glasses and some lubricating eye drops if there is no cataract on clinical evaluation.
So Catherine, kuhakikisha una miwani ambayo ziko sawa, kuzizoea, na pia kuna eye drops ambazo zinaweza kumsaidia. Now we have another call from Nyamira. Hello.
Hello.
Henry, habari ya leo?
Poa.
Karibu, uliza daktari.
Ninauliza, my dad alifanyiwa hiyo, nimeona hiyo video hiyo mara mbili. Ati Tenwek.
Alifanyiwa mara mbili operation Tenwek.
But hiyo macho yake haikuona mpaka venye alienda. What was the problem?
So alifanyiwa hiyo operation akiwa na miaka ngapi?
Akiwa na miaka 60. He died at 65 last year.
Okay. So operated twice. He says a surgery similar to what we were just going over, with no improvement.
Now again, as cataract, we are solving only one problem of the eye. Are there any associated comorbid conditions like glaucoma, which is increased pressure of the eye, any retinal problems? If the patient is diabetes, he can have a diabetic retinopathy. If there is optic nerve disorders, if there are corneal problems, then when we do a cataract surgery, if the problem of the cataract is sorted, like if the vision poor is because of cataract only, then you'll have a very good vision. But if there is associated condition, then that might be the reason for having a poor vision after cataract surgery, if it is an uncomplicated cataract surgery.
So Henry, daktari anasema hii surgery ni ya kusuluhisha ugonjwa wa mtoto wa jicho peke yake. Lakini kama kuna uwezekano kulikuwa na shida nyingine ambayo inasumbua macho, because when you look at the eye we are seeing kuna sehemu nyingi. Kuna cornea, kuna lens, kuna ile maji iko pale nyuma, vitreous humor, aqueous humor. So kama kulikuwa na tatizo lingine lolote na hiyo tatizo haikusuluhishwa, that surgery will not solve the problem completely. And if there were also any other conditions, kama kuna magonjwa mengine yoyote pia ambayo hayakuwa yameangaliwa, bado shida ya macho itasalia. Now, we were still looking at our video, so I think we can go back to it and finish. So we were at the point where daktari had gone into the eye and essentially removed, allow me to say, removed the cataract.
So now here you can see that we are just going to remove the cortical matter with the help of irrigation aspiration cannula. So when the cortical matter is removed completely, it is at this stage our cataract removal surgery is complete. So now we have removed one lens. Then you have to put another lens into that so that the patient sees. Because now you have cleared the opacity, but now you have to restore the vision. So once the cortical removal is done, we do some polishing, we are sure that the capsule and everything is clean, then we insert an IOL. So this is a viscoelastic, we are going to put it into that just to form a chamber of the anterior segment, and then we put an intraocular lens. So intraocular lens, and there are multiple types of intraocular lenses. It depends, and that depends.
Just there, Daktari, the people really want to ask questions about cataracts today. So you can have a seat, Daktari. So we have a caller. Hello.
Hello.
Hello, Bansi. Habari ya Embu?
Embu ni baridi mingi tu.
Baridi kwa kila mahali hata hapa Nairobi.
Wow.
Karibu uliza daktari, swali lako.
Now I have a problem with my eyes. I keep feeling foreign particles. And they don't go away. and the eyes become very itchy. What could that be a sign of, and what is the remedy?
Thank you so much for your question, Bansi. It ties into another question we have on SMS. She's asking, Daktari, what are floaters and are they treatable? I think we're talking about the same thing.
Yes. So floaters are related to the vitreous cavity. When the vitreous condenses and it degenerates, it detaches from the retina, and then it starts moving within the vitreous cavity. So when it starts moving within the vitreous cavity, when it comes in front of the lens, you feel like something is coming, like a mosquito net or a web, and again at a flash of light it is coming, and then again it is going. So floaters are mainly related to the vitreous cavity and retinal conditions.
How do we treat this?
So now we need to evaluate whether these floaters are because of posterior vitreous detachment. Again, posterior vitreous detachment is a common condition. It is a senile. Just like the age, with age the lens becomes blurry, the vitreous also starts degenerating. And then if the floaters are related to PVD, we just assure the patient that with time this will settle down and your problems will not be there. But floaters, if it is related to the retinal conditions like retinal detachment or epiretinal membrane, then we need to treat the retinal condition itself.
This is surgery?
Yeah, so surgery or injections, but first we need to evaluate the retina in those cases.
Okay, sawa. Now, the questions are coming in hot and fast, but we need to take a short break, and then we'll be back to see what types of lenses are available for you if you're suffering from cataracts. Welcome back. Now, our show today is proudly sponsored by CIC Insurance. Now, at CIC, your whole family is covered, and should you require cataract surgery, then our MediSure plan is sure to cover you. Now, if this is for your parents or any seniors above the age of 60, we have a seniors plan at CIC that is going to be ready to cover for senile cataracts and all other conditions. If you belong to a CHAMA, a women's group, or a men's group, then we have a cover specially for groups. Now, Daktari, a lot of people are looking at the surgery and they're saying this looks scary. So how long does this surgery take? What kind of anesthesia are we using?
Okay, now it actually is not as scary. There are 3 types of anesthesia we generally use it. In this surgery which we had done, you will not imagine. It was done under topical anesthesia, where the patient was not given any injection or any general anesthesia. So in this type of lens, you can see there is a central ring. That is an EDOF type of lens. Normally, lens which we put is a plain lens, but you can see this ring. You can see a slight, circular ring.
There's a circular.
That is specifically meant for extended depth of focus, to have an extended depth of focus. The patient after surgery can see both distance, intermediate and near. So after the surgery, usually patient needs reading glasses. But if you put this type of EDOF lenses, the patient will be more comfortable both for distance, intermediate, like computer work, and then also for near work. So he will be literally spectacle free after surgery. This was done under topical anesthesia. The time required to do the surgery was roughly around 10 to 12 minutes.
10 minutes?
Yeah, 10 minutes.
Wow.
The patient was not patched. We didn't patch the eye. He had a meeting at 4 o'clock and he called me, "Doc, I was able to attend your meeting. I'm very happy with that."
So in the morning, he was in theatre with you, and in the afternoon, he was in a meeting.
Yes.
Glasses free, without spectacles.
Yes, spectacle.
That's amazing.
And those patients who are very elderly, we give them local injection. After the surgery, we patch the eye for 1 day. Then we see them post-op after next day or the next day morning.
Okay, how about the toric lenses?
So this lens, if you see, there are multiple rings. In that, there was one such
that one just had one.
This has a multiple ring. This is a trifocal lens with toric lens. So this is the marking which I have done to put. The toric lens covers for the cylindrical power. So this is the, you can see these 3 dots. Those 3 dots are mainly to align into the axis and to cover the cylindrical power. The normal lenses cover spherical power. Toric lenses cover cylindrical power also. And the ring which was there in the center, it covers for near. It's a trifocal lens where it has 3 different foci. One for distance, intermediate and near. And the 3 dots were for cylindrical power. So again, this patient was spectacle-free after the surgery.
Okay, now we have a caller all the way from Kilifi. Hello.
Hello.
Hello, Sarah. Habari ya jioni?
Nzuri sana.
Karibu uliza daktari.
Nilifanywa operation. Miaka 3 iliyoisha. Alafu sasa ninapata tearing nyingi sana kwenye macho. I am 58 years.
Sarah, tunaomba upunguze volume ya TV kidogo ndo tuweze kukupata.
Okay.
Naam, Sarah, tuambie.
Yes, sasa napata a lot of tearing. Nakwambia napata a lot of tearing.
Ulifanywa operation ina gani haswa?
Nilitolewa cataract.
Cataract,
nilitolewa cataract mahali kunaitwa Lighthouse of Christ. Sasa ninapata a lot of tearing kwenye macho. Wakati mwingine naanza kuona kama macho yako na uchafu pia, kama matongo hivi mengi. Sijui nitumie dawa gani ama ni nini kinatokea, kinaendelea.
Daktari Rasala anauliza ni muda gani umepita tangu ufanyiwe operation?
Miaka 3.
Miaka 3?
Yes.
3 years after surgery, she's still tearing, a bit of discharge from the eye.
Okay. See, tearing is a very common post-op side effect after the surgery, but in most of the cases, it resolves within maximum 1 month if it is related to cataract surgery. But a persistent tearing after the cataract surgery need not necessarily be because of the cataract surgery if the vision is very good and if she is using glasses for reading or for distance. So then we need to see whether there is any problem in the lacrimal system of the yes, because 3 years of tearing with discharge, if the vision is good, if there is no redness, she is using glasses, she can see clearly, then it should not be related to the cataract surgery.
So pengine kunaweza kuwa na tatizo na yale mishipa ambayo yanapatiza machozi, the lacrimal duct system, and that might need to be looked at. Pengine kuna kitu kinazuia blockage or something like that, which might need to be checked out so that there's that clear flow of tears. Yeah, that makes a lot of sense, Daktari. Okay, now, Daktari, what are the costs for this operation?
Okay, just to explain in a layman language, if you want to go to Mombasa, you'll go by bus. Okay, you will go by your car, you'll go by chauffeur-driven car, you'll go by SGR. Again, SGR also now these days has levels, and then you go by flight. So the destination is Mombasa. So in a cataract surgery, destination is vision. You understand that? So our ultimate aim is to give a good vision. Then, depending upon the type of lenses, like Indian lenses will be cheaper, American lenses will be more costlier. Then there is monofocal lenses and there is multifocal lenses. Monofocal lenses means it has only one foci. So the mainly target we for the distance. So after the surgery in monofocal lenses, they will see very good near distance. For reading, they has to use glasses. If you're using multifocal lenses, then you'll have a good vision in all the ranges.
Okay.
So it can range from anything from 30,000 to 200,000.
Okay. Now we have a caller kutoka Gigi yaitwa Titus. Hello.
Yes, hello, ni Titus.
Titus, karibu.
Mimi kitambo nilikuwa na uwezo wa kusoma simu, messenger simu.
Uko na uwezo wa kusoma, Titus?
Messages ama kitabu. Kama iko 15 to 15 centimeters. Lakini sasa inabidi nisome ikiwa 30 ama 20, 25 hapo.
So kitu ambacho kiko karibu unasoma vizuri?
Siwezi. Inaenda mpaka 20 centimeters unaweza kufocus.
Una miaka ngapi?
Niko na 45.
45. So kama nimemwelewa Titus vizuri, ukishikilia kama kitabu karibu na wewe inakusumbua kusoma?
Naona overlapping one.
Na vitu ambavyo viko mbali?
Iko kama 30 centimeters na I focus vizuri.
So near vision. The challenge is near vision. He can see distant objects.
So again, I think it is...
And he's 45.
He's 45.
Yes.
It comes a simple diagnosis, mostly presbyopia. So he will read reading glasses and he will be fine.
So miwani tu yataweza kusuluhisha shida ya Titus. Okay. Now, Daktari anauliza, hello, I'm Violet, niko na shida ya macho, nahisi kiwasha, something like particles inside, then kwa jua nahisi nifunge macho, na pia anapata headaches. So this patient is having that sensation of particles, but at the same time a bit of photosensitivity with bright light.
Age. We know
she hasn't hajatupatia age. Violet, hatujui ana miaka ngapi. We don't know the age.
So now this is what typical complaint of foreign body sensation. So normally between the eye and the eyelid there is a tear film. The tear film acts as a lubricating for the eyes. So we blink in a minute up to 15 to 20 times
in 1 minute.
In a 1 minute.
Okay.
So now if that tear film is absent, we call it as a dry eye. So like if you have any machine, there is no lubrication, it will have a friction. So every time you blink, you'll have a foreign body sensation. That foreign body sensation will have an urge to itch, to rub your eyes. And then it starts with tearing and then photosensitivity, especially to light. It is commonly related to dryness and also allergic conjunctivitis.
All right, so a simple eye drops would be able to probably sort out her problem.
Yes, absolutely.
Perfect. Now we have a caller from Kiambu. Hello.
Hello.
Margaret, karibu, uliza daktari.
Nilikuwa nauliza. My mama anakuanga na shida ya macho, like nika kitu ina grow kwa hivi kwa macho.
Nini ina grow, Margaret?
Another layer. Yeah.
On which surface?
And then akienda kwa vumbi, ako so itchy sana.
So vumbi inaleta shida. Anasema another layer is growing on the eye.
So is it on the outer part of the eye? Can she see it?
Ni kitu ambacho unaona kwa macho. Unaweza wewe mwenyewe. Hello?
Yeah, naweza iona.
Unaweza iona.
Okay.
She says she can see it.
She can see it. So most commonly it can be a growth from the conjunctiva which is growing onto the cornea. We call it as a pterygium or a pincicula. So that might need a surgery if it is coming into the central part of the visual axis.
Okay, and what would she need to do for that?
First, she needs to get evaluated.
Okay, so that we establish exactly what it is.
The diagnosis.
Okay. Now we have a question. Anasema, hello, nimekuwa na shida ya macho, kuona blurry since 2021 nikiwa pregnant. When I asked the doctor, he said it's normal imbalance ambayo itasuluhishwa after delivery. Since then, sijakuwa sawa. So since her pregnancy, her vision just not quite right. Is that something that we should anticipate with pregnancy?
So that's a good question for two of us. So whether now she has a pregnancy-induced hypertension, she has a papilloedema, which was missed, and then she has a preeclampsia, eclampsia, all these conditions, because it is a sudden high increased blood pressure, and that also affects the eyes. At that time, if there is an optic nerve damage, she will feel like till 8 months of pregnancy I was very good. Suddenly my blood pressure shoots up, my vision has dropped, and after my delivery I have not recovered.
We're not resolving. So kuna uwezekano wakati kulikuwa na hiyo mimba, kunaweza kuwa na kitu ambacho kilitokea during the pregnancy.
Again, now I'm only guessing on the basis of the history and what I'm assuming. So she might need an evaluation.
An evaluation just to see if there could have been some damage that occurred. Now we had some before and after videos for some surgeries. I don't know whether that can be cued for us. All right, so as we looked at that, we have a question, and this is...
so this was a pre-op video.
Oh, okay.
You can see this is a 12-year-old child who had a bilateral cataract. In right eye, the cataract was more compared to the left eye. So we did the surgery in both the eyes, and then you have a... Can I have a post-op video?
The post-op video, please.
So this was 1 week after post-op. See, the eye is so quiet. There is no redness, no tearing, everything is... Okay, this is for the right eye. And then in the next week, we did the left eye. This is for the left eye. So the patient was so happy because he had a cataract maybe probably after 2 or 3 years of age. For 10 years, he was not able to see. Now he was able to see, read, go to school properly, confidently. He was able to answer the teacher what he's saying. So it boosts confidence in pediatric cataract. So much so that you change the life of a child in a cataract surgery.
Now, Doctor, is it always surgery? Are there medical options? Are there patients who have cataracts, but you tell them, you know what, not surgery?
Unfortunately, till today, since the lens has opacified, you know, now the opacity of the lens depends upon, if it is too much opacified, there is no medication right now which can clear the opacity and make it more clearer. So if you put a glass in front of an eye which is white, it will not work. You understand? If the cataract is in initial stages, it can work, but as the cataract increases in intensity, in grade of the cataract, we have to undergo a surgery. But it's an elective procedure. You don't need to do today. You don't need to do tomorrow. You take your time. You organize yourself. Usually, the timing depends upon when the patient feels is not independent. He's started becoming dependent. Then it is better you do
the
cataract surgery.
Now, if the patient is much older, would you say that maybe for that patient you would not want to rush to surgery if it is not too severe? Would you want to maybe keep them on these other options?
If she is okay, there is no other comorbid condition, I would say that you undergo cataract surgery, because if you keep the cataract there, it can go into mature, hypermature, and then you can have a cataract with glaucoma. So when a cataract with glaucoma occurs together, we call it as a phacomorphic glaucoma or a phacolytic glaucoma, then the chance of losing vision completely is very high. So then even if we do surgery, he will not have a good vision.
Now, Dr. It's been an absolute pleasure having you on the show. What are your closing remarks, just the last things you'd like our viewers to remember about cataracts and generally about the eye health?
See, eye is the most sensitive organ of our body. We have to protect it. We have to take the vision if there is any vision loss early, especially kids. You know, you can tell, you can't see properly, but the kids can't see.
Might not know.
So evaluation of kids and taking care of elderly is very, very important. And cataract is a simple surgery in today's world, and earlier you do, it is always better to have a good restoration of vision.
Okay. Now, so many thanks to you, Dr. Rasul.
Thank you so much. Pleasure to be here. It was nice interacting with you.
And thank you for our proud sponsor, CIC Insurance. Now, here we are giving you visions of hope. There is hope for cataracts. There is so many options. And Dr. has said we have a whole range of options and prices. So please do not suffer in silence and do not be afraid. Solutions can be found. And in 10 minutes, you can attend that meeting or that show in the afternoon with 20/20 Vision. Now, until next Sunday, please stay tuned and please keep safe.